welcome. It's Chris from Christopher Hole Training. Welcome to this week's whiteboard where we're talking about lower back pain treatment, and we're going to be talking about trigger points. Now, there are a lot of different treatments or symptoms and ways of managing lower back pain. One of the key ones that I use is trigger points. Now, these aren't necessarily at the site of the lower back, but as we go through this whiteboard, I'll explain more about trigger points, where you might be able to find them, and how you might be able to treat your lower back pain if it is trigger points. And that's the key thing. We have to understand that if it is trigger points. If it is a trigger point, then you can obviously use the information that I'm sharing with you in this video. If it's not a trigger point, then you're going to be sort of setting yourself up for failure, if you will. So what you will need to do is go and get your back assessed and make sure that it is a trigger point, and then you can use the information within this video. If you want to, please do explore and experiment with the information in this video to see if you think it is trigger points, but I do recommend going and finding someone who'll be able to assess you correctly. So what we're going to talk about in this whiteboard, first of all, we're just going to explain a little bit about what lower back pain is. Then we're going to look at the lower back pain trigger points, and then we're going to talk about how we can treat them. So we're going to do it over a couple of slides. So as we go through, I'll be sharing this information. Before we get into that, I will just mention my social media. So if you want to come along, please do like and follow. It'd be great to have you there. On Twitter, it's @ChristopherHole, and on Facebook, it's Christopher Hole Training, and on Instagram, it's Christopher Hole. So it'd be great to have you there. Alternatively, you can come to christopherhole.com/join. You can join the monthly newsletter where I'm sharing information like this and on other subjects of health and fitness. I try to keep that umbrella nice and broad because then it allows me to talk about injuries, exercise, nutrition, diet, habits, behavior, and we can explore health and fitness from a much broader perspective. So if you want to come along there, just add your name and your email address and you'll receive our monthly newsletter. So again, come along to the website. It'd be great to have you there as well. So what we are talking about today are trigger points. Now, when it comes on to lower back pain, first of all, back pain is very common and normally improves within a few weeks or months. The pain in the lower back is particularly common, although it can be felt elsewhere along the spine from the neck to the hips. Now, with regards to lower back, this is the general area that we find it, but as the NHS do suggest, it can be felt all the way along the spine. In most cases, the pain isn't caused by anything serious, and this is the most important part of this sort of section of writing, in that the pain isn't normally caused by anything serious, and we usually get better over time. Now, that's useful because the pain will get better if you leave it. But what we do want to do is we want to try and overcome that underlying problem. Now, one of the underlying problems that it could be is trigger points, as I've mentioned. And if we can sort of remove that underlying problem of the trigger point, then the back pain will essentially go away over a period of time, but then it won't come back. But if it does come back, it will come back sort of less painful, if that makes sense. And it's a big thing with lower back pain in that most of the time it is something that's not that serious, but because of the pain people can feel, it feels very serious. So if we can start off with understanding, is it trigger points or is it not trigger points? If it is trigger points, then it's something quite simple that we can manage, and it's something quite simple that we can treat. Now, we can do this on our own, or we could do it through another therapist or clinician who is familiar with trigger points. So the key, again, as I mentioned, is figuring out, is it trigger points that we need to be treating? If it is, it can be quite simple to overcome, and it can bring quite a bit of pain relief quite quickly. So that's lower back pain, and that's kind of an introduction into trigger points. But now we're just going to talk a bit more about the lower back pain treatment and trigger points. So a trigger point or muscle knot are commonly caused from stubborn and strange aches and pains, and yet they are underdiagnosed. So what it basically is you've got, if you can imagine your muscle, so this is a big muscle and it's made up of all these individual fibers. Now, these individual fibers can become tight and knotted, and that is, in essence, a trigger point. It's just little contracted compartments of a muscle that get stuck there. Now, what we have to do or I have to do as a therapist, or you can do as someone with a trigger point, is we have to then release that trigger point. And what tends to happen is when we release the trigger point, it can release all the toxins that have built up within it, and then that can make it a bit sore in the preceding day. So we have to understand, if we are treating trigger points and massaging delicate areas of the body, then we have to understand that there might be a period of time where it feels quite sore and quite painful. But that's all part of the healing process. So if we've got these trigger points that do go underdiagnosed, so hence why I'm talking about it, because a lot of people come to me, they've been to chiropractors, they've been to osteopaths, and it's not to say they haven't done their job correctly. They might not look for trigger points because it's not a part of their remit, or it's not a part of their understanding, if you will. For some it might be, but for some it might not be. So what I tend to do is I will tend to explore for trigger points first, because again, it's not massively serious. It can be quite easily treated, and you can get quite a good benefit quite quickly. So I will always go there first. If it turns out it's not trigger points, then I will refer out to the adequate physio, osteopath, chiropractor, whoever it might be, that could better treat the injury. But most of the time I do find it's trigger points, and most people are in pain because of trigger points, but they don't necessarily get them treated because the therapist isn't necessarily looking for them. They're looking somewhere else. So when it comes to lower back pain, what we're talking about is, with the trigger point, is you'll get areas of pain. So you can see here there are 3 different trigger points, and there are 3 different areas of pain. So it's recognizing first, and this is something I always ask people, is where do you feel the pain? And they'll point it out to me. It might be right at the base of the back. Well, okay, great. This is where I need to look at this trigger point. If it's sort of buttock and starting to go down the leg, then I'll look for this trigger point. Or if it's possibly to one side of the back, on the left or the right, but it's lower back and goes into the buttock, I will go into this trigger point. So I basically use a manual. I have a manual with a sort of like a library of trigger points all around the body, and in some degree I will take that manual out and I will say, right, can you point to where you feel the pain? And then what that tells me is where the trigger point is and where is the most effective place for me to start my treatment. So I will then go about treating it in that way. So first of all, I have to understand what pain they're feeling, then I can understand what trigger point I need to go looking for, and then I will then go looking for the trigger point. So in treating a trigger point, it's quite simple. Now, with regards to massage therapy, there would be more that goes sort of around these 3 bullet points that I'm going to talk you through. We would warm up the area, we would mobilize the area, we would obviously explore in other areas where there could be other trigger points that are affecting it, and so on and so forth. So there's a little bit more to it, but in essence, if we can figure out what the trigger point is, how we treat it is quite simple. Is we can use a finger, a thumb, a tennis ball, a knuckle, a fist, a foam roller. There's lots of different sort of implements, but the idea that we want to use our finger, thumb, tennis ball, or whatever for is to apply pressure on the trigger point. And what you can do is you can make small little circles on top of it, or you can move it back and forth. All that's doing, that's just applying pressure to the trigger point and allowing that muscle to start to relax. Now, with regards to how much pressure, is we want to apply enough pressure for a 7 out of 10 score. Now, what that means is if 10 is you're going to, jump off the couch if you're on a massage couch, and, you want me to stop, that would be 10 out of 10. So it wants to be anywhere between sort of 5 and 7 out of 10. And that what that's doing is that it will be an uncomfortable pain, but it's not a pain that you can't tolerate. It's something that you can tolerate. In some degrees, it might feel quite nice because although it's painful, there might be a sensation of release, Sometimes when I'm treating people, what they will say is they get a very sort of warm, radiating feeling in the area. And all that's telling me is that the trigger point is starting to release and blood is starting to flush into that area, which is that warm, radiating feeling. So as it starts to flood into the area, what I know is that the trigger point is starting to relax and that the healing process is then starting to move forward, if you will. So with regards to you treating your trigger point, obviously be very careful, understand what you're looking for. If not, please do go and find a therapist who can look for trigger points, and ask them. They might treat it for a while, and then they might suggest to you this is something that you can be doing on your own, and they'll obviously talk you through it. So when it comes to treating them, it's quite a simple thing. As the quote said at the start, normally back pain isn't that serious. If it is a trigger point, it's not massively serious. It can be treated quite quickly. It's just knowing the right place to treat and knowing what you're treating. So hopefully that's been of help. Hopefully you can now go away with a little bit more confidence that your back pain isn't as serious or isn't as debilitating as you might have first thought, because it can be cleared up quite quickly. And hopefully you can then go about treating that and getting it sorted, and you can overcome that lower back pain as quickly as possible. As I mentioned at the start, please do come along to my social media channels on Twitter, Facebook or Instagram that you can see here, or come to the website. It'd be great to have you there. Sign up to the newsletter. You'll get information like this on there. I do share exclusive videos around this topic and anything on health and fitness. So yes, please do come along there. It'd be great to have you along. Many thanks for watching. Many thanks for listening. My name is Chris from ChristopherHole.com. I'll speak to you in a future whiteboard.